It was 2015-ish, and I was laying in bed sick with mono and severe pain in my spleen, and all of a sudden my head started spinning around like that scene in The Exorcist. Well, it wasn't really spinning around. It was twitching back and forth. So, of course, I had my very first panic attack because I sure thought I was possessed. Didn't really. I just was scared to death. I woke up my husband, told him he had to take me to the ER, and ran out to the car praying to God the whole entire time. Please don't let me die. Please don't let me die. While my husband was getting the kids up. My daughter was in 3rd grade. You need to remember that. It's very important to this story. We got to the ER, and of course they gave me anti-anxiety medicine, but I was still twitching. And of course the doctor said that he didn't know what it was, but it was definitely something neurological, and that I needed to go see my very first neurologist. And the time that it took to see that guy, my spine started hardening. Both sides of my neck started hardening. My head felt like I was laying on a rock all the time. That wasn't even the worst of my symptoms. While I waited to see my neurologist, the next few months I developed new symptoms. If you thought that the spine hardening, the neck hardening, my head feeling like a rock, the twitches, the head shaking was the worst of it, then you thought wrong. One night I was cooking dinner, and 30 minutes later, I looked down at my pan. I had been staring at the wall for 30 minutes while my dinner burnt right in front of me. The only reason I noticed is because my husband came up behind me and said, "Why are you burning our food?" I started sleeping literally 20 hours a day. I could not get enough sleep. It was never enough. My entire body felt like it was bruised. I started developing severe depression so badly that I was crying upon waking up. Like I woke up and there were literal tears rolling down my cheeks. So I was literally crying in my sleep. I Googled a lot and everything kept coming back to Lyme disease. I went to my PCP and told her all my symptoms. Even told her that I thought it was Lyme disease. And if you thought this is when I got my diagnosis, within 3 months, then you couldn't be any more wrong. My PCP sent off a Lyme disease test and all of the other tick infection tests. All of them came back negative. Surprise, surprise! She said there was no possible way I could have Lyme disease because the test was negative. So she diagnosed me with chronic fatigue syndrome, fibromyalgia. So I just went back home and dealt with it. Thought this was going to be my way of life for the rest of my life. That's when I started drinking coffee. I started getting a little bit better, but not all the way. This is about the time that the severe depression, where I was crying in my sleep literally, started. And so I went back to her and I told her I was really, really depressed. I was about to go on vacation to the beach, and she gave me some antidepressants. And I went to the beach and I felt so good. So good. Better than I felt in a long, long time. And then I got back home and it started all back up again. And it made me wonder. Fast forward a month or two and it was time to see my neurologist. I'm not cooking tonight, so we're rewinding. And I'm going to tell you when I thought I got bit by a tick and got Lyme disease. Before the mono. We were living on a farm. We had deer galore in our backyard every single day for like 3 to 4 years. And one day I looked down because my leg was itching. And I had the little bullseye rash. And I was like, that kind of looks like Lyme disease that I've heard about but don't know much about. But I would be really sick if I had Lyme disease. So I didn't think anything about it. Just went on to living my life with 2 young babies, you know. Everything was going great. And then I think about a year later, I started like having trouble walking up steps. It was just super hard. Like my muscles weren't working right. So I went to my doctor and I loved my doctor. But, you know, there was no mention of a tick bite or anything when I talked to him about it. So he said, "Oh, you have depression." Even though I was perfectly happy. That was my very first time taking antidepressants. It was time to see my neurologist, and I had developed even more symptoms. I kept feeling like my head had a tight rubber band all the way around it from top to bottom, all the way to the base of my skull. And then I started screaming out in pain because every now and then it felt like somebody was screwing little miniature screws inside my brain.
Isn't it lovely?
Now that I know that it was Lyme disease, it's pirouettes, and they look like little screws. So that totally makes sense. I told him all of my symptoms, and he focused on the pain in my head. Even though it wasn't continuous, it was like a split second when it would happen. He prescribed me migraine meds, and I was like, I don't think I have migraines. And he also told me he was going to run some more tests. So I went home and took those migraine meds that he gave me, and I cried for 3 days straight. So I immediately got off of them because I didn't want to cry for the rest of my life. So we do the MRI, and then I go back and I see him, and he's showing me the picture of my MRI, and he was explaining a bunch of stuff I don't understand. And he said, everything looks fine. And I said, well, what's that little bitty white spot right there? He said, oh, that's nothing to worry about. That would be worrisome only if you had those all over your brain, because that would mean you have MS. Well, guess what? That was the Lyme disease. Anyway, he couldn't figure out all of my twitches and my head shakes and stuff, but he did say that he thought they were seizures, and he was going to send me to a specialist in Literal. So there I was, waiting to see another specialist. While I waited, I went to see my PCP, told her what all he said to me, and then she prescribed me an anti-anxiety medication for my seizures. Even though the neurologist didn't say anything about anxiety, which still to this day, that is the only reason I really liked him. I mean, he was nice and all, but you know, at least he didn't tell me it was anxiety. The anti-anxiety medicine didn't stop the seizures. They just stopped me from freaking out. So that was the second prescription I was prescribed to cover up my symptoms. I forgot to tell you, my neurologist also referred me to a neurosurgeon. Why would he refer me to a neurosurgeon, you ask? Oh, because my neck was hurting. So I went to see the neurosurgeon, and I absolutely loved her to pieces. And the weird thing is she kept touching my feet and saying, look at that, talking to her helper in the room. Like, isn't that something? That's so cool how her foot does this. So she did an MRI, and it turns out that I have a bulging disc from these stupid seizures. So, of course, they pumped me full of NSAIDs. I really did not want to do surgery because I've heard horror stories, and I'm afraid that if I got seizures again, that it would just pop it right back out, you know, and I'd go through all that pain of surgery again for it to just like happen all over again. So I chose not to do it. But if I ever do have to end up having surgery, I will definitely go back to her. One day, I was sitting in line waiting to pick up my daughter from school, and all of a sudden it felt like Freddy Krueger was inside trying to claw his way out. So then, of course, I had to see a stomach specialist. Freddy Krueger was in my stomach, and it felt like he was trying to come out through my belly button with those, like, sharp claw things that he had in the movie. Well, not just my belly button, my whole entire stomach. So I went back to my PCP, told her what was happening. She thought it was an ulcer. I waited to go see another specialist. While we were waiting on that, I talked to her about me burning my food and staring at a wall. And she was like, well, you probably have ADHD. So I had to go to another specialist to get a diagnosis of ADHD, and the guy was a complete fucking asshole. I hated him. Oh, but I did get diagnosed with ADHD, and so we tried 3 different ADHD medications. Now, don't get me wrong. Lyme disease did not give me ADHD. Now that I know, I've had it my entire life. I know for sure I have. But this was like severe ADHD. Like, I couldn't do just normal things. I would just like stare off into space all the time, which I don't think that was ADHD. I think it was probably something else to do with Lyme. But I did get on medication for it. We tried 3 different ones before we finally
switched to one that worked. And man, it was so nice to be able to do things like that I've never been able to do my entire life. But then I started having super dry tongue, and I'm talking like sandpaper tongue. And I remember being at a parent-teacher conference, and I couldn't even speak correctly. They probably thought I was drunk because I was slurring my words because my tongue wouldn't let me talk. Went back to my PCP. She took some blood work. Oh, and I forgot to tell you that she also prescribed that ADHD medication for my chronic fatigue. So that helped me with that. But I had something that required a rheumatologist. So off to the next specialist. It was 2016, and it was time to see the seizure specialist. I had to stay in the hospital for 3 damn days. They sleep deprived me. That's the only thing I remember about it. And I did have seizures and my spine hardening and everything. And they had a video on me the whole entire time. Oh my gosh. I don't know what they call it. So the doctor comes in and he tells me that I have non-epileptic seizures and they're caused by anxiety. And that he's had men, women, all ages come in there, and that's what they have. And so I believed him. And he told me that I needed to do therapy and join groups and find like-minded people that also have non-epileptic seizures. And so I went to therapy, and the seizures didn't stop. But then I started going on the keto diet. Not because of this, just because I was like, well, I'll try the keto diet just to see if I can lose some weight. And I did. And the seizures stopped. It was really weird. I don't know why. Next up, I went to see the rheumatologist. They tested me. And of course, I had Strogens. Strogens makes your mouth and eyes dry. And mine sure were dry. It was like sandpaper. So I learned I had to deal with that for the rest of my life. Or so I thought. Next, we will be visiting the gastroenterologist. Oh, and I started developing even worse symptoms, being paralyzed. My daughter was in the 5th grade, and she started getting sick. Thankfully, it was at the end of the year, and she didn't have to go back. She was seeing the same PCP as I was. I took her in. They did blood work. Things were off on her blood work, but she said that she's just going to let her see if she would feel better after she got home. Anything. Oh my gosh, I've already started crying. I did push for tick infection tests. One came back positive for Rocky Mountain spotted fever, so they treated her for that. But they said that it was an old infection, but they still treated her anyway. She didn't get any better, really. She was still sick. I even took her to the children's ER, and they did absolutely nothing. That whole summer was a complete nightmare to watch my daughter go through what she had to go through. But thankfully, through Facebook, I was able to find a doctor in Arkansas. Actually, 2 that would listen to me about Lyme disease. To save my daughter's life, I traveled to the doctor that I found. I paid out of pocket, so I didn't have to worry about losing my PCP. But guess what? She found out about it anyway and refused to see my daughter. We did some testing. My daughter did test positive for Lyme disease, and we were able to get her the correct treatment. Watching her go through what she had to go through, it opened my eyes that maybe I had Lyme disease. I was about to fire my PCP because she fired my daughter. Who fires a 5th grader? I think it was just because her feelings were hurt because she was wrong. But I had to wait so I could get insurance to pay for this next doctor. It was an integrative doctor, but she also had an allergy clinic. So I was using the insurance to get in there and pay for the visit. At this point, I was on keto, but I kept losing weight at a rapid pace. And my stomach was still messed up. I hadn't seen the gastroenterologist yet to find out what was going on. Like, it was severe. Let me show you a picture of what I look like. Okay, this was on keto, and I was on vacation. I look great. I look healthy. And this is me when I started losing weight rapidly, and I was really sick. Look at those circles under my eyes. You can obviously tell in these next few pictures that I was very, very ill. These next 2 pictures were taken 3 days after I was in the ER. I had gone because I could not speak. Now, the no speaking part was coming and going. It would stop and start. My spine felt like it was coming out of my skin, and my arms and my hands were turning and twisting all on their own. So I went to the ER, and within 5 seconds of the doctor coming in the room, he told me, sometimes things are just all in our heads. And I lost it. I started screaming at him. I completely lost it. So I'm sure he thought I was crazy. And he left the room, slammed the door, and said, I had patients die on me today, and you're not going to die on me. Well, anyhow, it turns out that my potassium had bottomed out. And that's what was wrong with me. And he said, see, it wasn't all in your head. And then, thank God, that was the weekend, and I got to finally see that integrative doctor. Oh, like I finally got to see her, and I thought she wasn't going to believe me. I really did. I prayed every day to God to just take me. That's how miserable I was. The only reason I kept fighting is for my children. My eyes were opened once my daughter got diagnosed, and I had done my research. I knew I had Lyme disease. I knew it for a fact, but I couldn't get anybody to listen to me or treat me. Multiple doctors, multiple specialists. It was time for me to see the integrative doctor I had waited months for. And when I got in there, I was a nervous wreck. It was the weekend after I had been in the ER, and a doctor had told me 5 seconds after walking into a room, sometimes things are just all in my head. And then, after finding out that it was potassium dropping in my body, he said, see, you're not crazy. My integrative doctor was an angel from God, and I'm not even kidding you. She sat in there for an hour and a half with me, going over everything. When I told her what had happened to me at the ER, she rolled her eyes, and it wasn't at me. It was at the doctor. She wanted me to do blood ozone treatment, 10 sessions. And the reason that she knew it would work is because she's had Lyme disease, and that's what she used. But at the time, we could not afford that because insurance wouldn't pay for it. So she put me on doxycycline, and I felt so much better than I have for a long time, even though it messed up my stomach really bad. But then I got off of it because my 30 days was up, and I went back to her, and I told her that I was back to feeling like I was before. So she put me on another round of doxycycline for 30 more days. I felt better, but just because she treated me for Lyme disease does not mean that everything got 100% better right away. And I still had to see the gastroenterologist. Remember when I went to the ER and the doctor told me that I wasn't crazy, even though he assumed I was? Well, a few days later, I was in Branson on a vacation. I was pushing through for my family, just saying. And this popped up. And you're thinking, oh my goodness, Angeline, you had ringworm. That's not what it was. It was the size of a dang softball. So anyhow, that next week after that weekend getaway, I went and saw the integrative doctor finally. And I showed her this picture and said, there's something weird. I told her everything that had happened at the ER. And I showed her this. She said, that's Lyme disease. It was that easy. Like, I showed her that, and she said, that's Lyme disease. After all my symptoms. She even took a test, and of course it came back negative because I've had it for so long. But doctors can diagnose you with Lyme disease without tests being positive. Did you know that could happen? I mean, my son has been diagnosed with strep throat and treated for strep throat because he never test positive for it. But oh my God, Lyme disease? Lyme disease couldn't possibly be diagnosed if your test comes back negative. The classic bullseye rash is this right here. That's not the only one you can get. You can get this one. You can get this one right here. That's the one my daughter had. You can get this one and this one. And then mine was kind of like this one. But there was no like bite because I've been bitten years before. So yeah. And then I was going back trying to find that one photo. And this is from 2020. it popped back up again for some reason. I don't remember why. I just remember seeing it, and that was the date. It was on the side of my stomach, and it was a softball. So, yeah. If you thought Freddy Krueger in my stomach was bad, just think. After I got off that doxycycline, oh my goodness, it was like Freddy Krueger and Jason were having a fight in my stomach, and I'm not even kidding you. Integrative doctor thought I had an ulcer, so she gave me all the treatments for it. And I did all the stuff I was supposed to do, and there was this one medication every time I took it, the inside of my body felt like it was shaking, like literally. It was time to see the gastroenterologist. And I went through all that mess to find out nothing was wrong with me. And I remember crying in the recovery room afterwards. And the nurse said, "Are you okay?" And I said, "Yes." I said, "Ever since I've had this Lyme disease, nothing in my body wants to work right." I don't know how much longer it was until this happened. But I went on vacation. And while I was on vacation, my stomach stopped hurting. And then the second I got back from vacation, I got some water out of my refrigerator and my stomach started hurting. So I figured out it's our tap water, that something's wrong with it. I also went organic, and going on organic coffee helped me so much better. And then also my integrative doctor wanted me to go to gluten-free and dairy-free. I did go dairy-free for 2 complete years. And things did get better. Not everything. First medication I was prescribed to cover up symptoms of Lyme disease, an antidepressant. The second prescription, Adderall, to cover up chronic fatigue and ADHD, which I did actually have ADHD. But she was trying to cover up the brain fog I was having. Third, blood pressure medicine. I don't have high blood pressure anymore after I treated for Lyme disease. What else? Oh, fourth. What was it called? Some kind of anti-anxiety medicine that starts with a V to cover up my seizures. But even though they didn't help with my seizures, they only helped me calm down when I had seizures. Fifth. What else? There was something else. Oh, did I also mention that the Adderall that she gave me, she was so glad that I was losing weight on it, that she wanted to also continue because she wanted me to keep losing weight on the Adderall. Oh, I got off the blood pressure medicine after I lost weight. And then I gained all my weight back just now. Like, I've gained my weight back, and I don't have high blood pressure. I don't know why. I think it was just the Lyme disease. Oh, I 100% believe that my estrogens that I was diagnosed with, the autoimmune disease, was because of the Adderall. Integrative doctor told me to get off Adderall because it's basically like taking meth but in smaller doses. Oh, I also got off of the anti-anxiety medicine that starts with a V. They said it was like something addictive, but I didn't take it every day. I took it like when I had the seizures. And also, I'm not an addictive person. I never have been. Anyhow, I got off of everything, and I'm no longer on any kind of prescription medications. But yeah, I had the mother forker gene. The MTHFR gene. It's a gene mutation. And I knew I had it. I knew it. Because people that have Lyme disease have that most of the time. Like, if they can't, get better after antibiotics and stuff. That's what it is. I have the mother forker gene. And I knew my son had it. So I'm going to get him tested. And my daughter probably has it too. I'm going to get her tested. And I probably got it from my daddy. So, yeah, I'm just so excited. I finally know that I have the forker gene. I'm just so glad I finally, the answer to all of my problems. And I've got to talk to my doctor because I don't really understand all of it because there's lots of science behind it. But it's the reason that I'm not getting better. And I Googled it, and it, gives you high homocysteine levels, and you can't drink coffee because it raises your homocysteine levels. So that's what's been wrong with me. Why I can't drink coffee anymore. So for whatever reason, my homocysteine levels are, after 45 years, raising really high. So I don't know what this means, but hopefully it means that I'm on my way to healing. I'm so